Aloha, everyone, for International Healthcare Simulation Week 2022. And my name is Dr. Jane Smitten. I am currently the Associate Dean and Professor at the Hawaii Pacific University College of Health and Society. I'm also the Director of the Simulation Center and the Interim Public Health Chair. And I'm pleased to say I'm going to be the President in 2023 of SSH. I'd like to turn it over now to Dr. Michelle Higgins-Mahi, who will give a little overview of her background. Michelle.
Thank you, Dr. Smitten. Hi, I'm Dr. Michelle Higgins. I have been a simulationist for a very long time. I love to do sim. I work at the School of Nursing for Hawaii Pacific University. My background is in med surg and trauma, so it's very exciting to bring all of that experience into the simulation lab. Dr. Smitten, I'm going to hand it back over to you and we'll go on to our next slide.
Right. So without further ado, we're just going to first and foremost let you know that the disclosures, there's no relevant financial disclosures, no conflicts of interest. Primarily what we're presenting to you today is what we've read and what we've learned about in simulation and our own experiences and our own opinions.
Yes.
So our objectives today, we're hoping that you will be able to, first of all, adapt, apply, or reinforce the 5 steps from the formula Technosapien experts in your simulation-based education worlds. This was inspired by us, or inspired us in relation to this whole session, because it was a Formula One scenario on simulation, and they really grabbed our attention with the headline, "Don't guess about the future, simulate it." So that's where we're going with this one objective. The second one, of course, is to inspire to incorporate or advance an area of excellence in your particular community of practice in the near future. And Dr. Higgins will be citing some examples relating back to where we have to really look at in regards to our roots so that we move forward towards excellence in simulation. So over the next while, we're going to provide our views of these steps. And first and foremost, welcome to all of you who are taking this session in, you simulationists, technosapiens, or however you want to be identified. We've been reviewing articles and initiatives in many sources, and we were inspired and really hope to share our reflections of that today. In addition, we'll be able to, at the end, have a live session for any Q&As that you wish to discuss with us. So onward. And technosapiens, well, essentially technosapiens are identified as the new intelligent species of Homo sapiens integrating technology. Oh, next slide. And so for the purposes of our presentation, we're proposing the evolution of Homo sapiens with technology driven imagination in our diverse worlds of simulation. So from this article, towards excellence and looking at what we're focusing in on applying simulation in our worlds, the step 1 in that article really focused on data, and simulation requires data. Simulation data curation is just essential for us to move forward in our worlds of simulation. We are going into a world of healthcare simulation, and we're trying to make a difference. So big data is important. Oh, back to data. The Formula One expert really states that curating the data fuels simulation. And so there's all kinds of data samples that we wanted to focus on today, and that is related to thinking about our research data from the many facets of where we come from, data on patient outcomes, data on evaluation, data on return on investment, even our learner contact hours data, because how these relate to our research and to our success in the future is very important information. Indicated in the article too is examples were abound regarding the educational development in simulation. So looking at where we're going and building our teams with audiovisual, virtual reality, augmented reality, robotics, there's just so much to learn. And so when we're looking at step 2, we're really focusing in on building our simulation teams, all towards quality improvement and patient safety outcomes. This also takes into account our infrastructure planning, and that is something that we do need to focus on more, related to what is required for building our teams to make sure that we have the essential foundation towards creating those teams. Excuse me. We want dynamic, cohesive, collaborative teams, and we know that simulation is an art and a science. So it's taking that into consideration in relation to building our teams so that we have the diverse teams that address these particular areas of art and science. Next slide. Building our teams. We want to create, implement, and optimize our program goals wherever you are in your organizational development. And it's really important for us to explore and expand in a purposeful way. This came through loud and clear in relation to the steps for the Formula One team. And so, again, the analogy and bringing this into the simulation teams world is so critical and crucial for our future. And then finally, strengthening the teams. The technosapiens refer to the simulation engineers and waking up and thinking about design. Well, we think about it in an analogy. You know, we are creating, we're designing, there's inventing and researchers happening, researchers talking about things that we can do that relate to maybe our entrepreneurial work in the future. So all these are relevant to strengthening our teams and connecting with each other. The step 3 they talk about is employing offline sim approach. So we're creating, in their case, they were creating all kinds of scenarios and choosing of the best. And in our cases, we have to think about what kind of scenarios we're producing related to the modality. Are we addressing learning styles, the unique abilities and the challenges, and also the what ifs, what's happening in our development of the sim scenarios that we need to realize and think about in the development towards excellence. Implementing offline sim is helpful because it helps optimize us towards the reactions and the outcomes. In step 4, we're exploring human in the loop. So ideally, we're preparing and rehearsing, as well as having the actual individuals work towards what we need for the sim objectives and goals. That makes sure that's incredibly important to get the best bang from our objectives. Again, it reinforces the what ifs. When we're doing our rehearsals and preparation, we're starting to think about, you know, what happens if this scenario changes or this particular portion of the scenario creates a bit of a challenge. So the analogy from the Formula Ones is making sure that we test using the human factor. And that is ideal. It doesn't happen all the time. So that's something we want to address as well today and relationship to working towards excellence in the standards of practice for the development of our sim scenarios. And finally, step 5, democratizing sim data and analytics. We have so much to share with one another, and it's really important to make the sharing of the data and the information dissemination visual and accessible for all. We have so much insight and so much impact from our involvement of humans and technologies with simulation. So I'm hoping that we can focus on this in the future as well. And in saying that, I'm going to turn it over now to Dr. Higgins, who is going
for your introduction. Aloha, everyone. As Dr. Smitten has discussed, our future in simulation is rapidly evolving. We see simulation being used, as Dr. Smitten stated, in the areas such as Formula One. That's very exciting. Innovations in simulation are being used in very diverse environments, including, but not limited to, healthcare, in the military, flight training, gaming, and of course, some of the newest platforms such as virtual reality, VR, and artificial intelligence, AI, are not only being used for entertainment, but are being incorporated into our learning environments. It is exciting to have all this advancement in the field of simulation, and I am sure we are all looking forward to what the future has in store. However, as sim educators, we need to be sure that we continue to build strong foundations as we move into our future innovations. As simulation training continues to expand and become increasingly common throughout education, educators have established best practices. Of course, this approach ensures that the simulation experience is consistent and provides the most benefit to the learners. To help guide educators, for instance, the International Association for Clinical Simulation and Learning states simulation best practice includes having defined goals and objectives, a sufficient pre-brief, an established case scenario, and adequate debriefing. We have found that the literature continues to reiterate the importance of conducting a briefing before the simulation training, as well as other foundational strategies. But we have also found that the literature continues to state that we are missing important roots and strategies within our best practices. Studies have shown, for instance, that briefing before cardiac surgery decreases disruptions and improves team communication. In simulation, the pre-briefing serves to set the tone for the upcoming learning experience. Importance of a pre-brief. The literature has identified that there are 4 components to briefing in advance of the simulation activity. They consist of reviewing the session's goals and objectives, establishing a fiction contract with learners, providing logistic details about the session, and pledging to respect the learners. I would like to review these 4 components. First, reviewing the session's goals and objectives. This component includes reviewing the learner's objectives, outlining the simulation session sequence of events, including the timing of the debriefing and the evaluation, familiarizing the learners with the simulation equipment and environment, and explaining the roles of the educators. By outlining what educator expects of the learners, they will be more engaged and have a greater chance to meet the session's expectations. For example, ensuring that the learner's objectives are given to students prior to the event may be a week, a day in advance, depending on what type of simulation is being done. As educators, we need to assess the needs of our students. This may mean that we send the new students very detailed pre-instructions or briefings, whereas more advanced students maybe just outlines. The next component is establishing a fiction contract. As we know, a fiction contract is an explicit agreement between educators and learners that the learner engagement is dependent on both parties. The educator is responsible for creating a scenario that is real and as possible within the limitations of the simulation environment. The learners are responsible for fully engaging in the simulation and acting as if everything is real. Learners should expect to play an active role in the scenario. Establishing a fiction contract attempts to minimize the blame a learner can place on the realism of the scenario affecting their performance. Next component is providing the logistics details about the session to the learners. During the briefing before simulation, educators often emphasize the session content while disregarding the logistical details. Some logistical details that should be included are the length of the session, location of the bathrooms, availability of the refreshments, breaks, and how to manage telephone calls, pages, texts, and even emails throughout the session. These, as they say, hygiene factors, if inadequately addressed, can lead to dissatisfaction and disruptions for learners. By explicitly outlining the logistical details, the learners can concentrate on the simulation session and be aware of educators are sensitive to the learners' other possible needs. Finally, pledging to respect the learners. To respect learners, educators must value the learners throughout the process. Instead of viewing actions as correct or incorrect, educators can inquire about the learner's decision-making process and rationale behind their choices. This approach provides the educator insight into the learner's knowledge gaps and helps guide feedback. Also, educators must acknowledge the belief that learners are bright, competent, and trying to their very best at their current skill level. As stated in the literature, each learner is striving to improve by communicating the importance of the learner's thought process. It conveys respect. Strongly and consistently, the literature states that it is imperative that the educators create a psychologically safe environment. This safe environment helps the learners to feel comfortable both making and learning from mistakes. Simulation educators can support and engage a distressed learner through debriefing strategies such as acknowledging learner feelings, giving the learner control, and using advocacy and inquiry questioning. By using this mindful approach, educators can lessen psychological distress, maintain psychological safety, and improve learning during simulation education. Another method to help with distressing simulation activities is ensuring transparency. Be clear about the learning objectives, outlines of the simulation, and the type of evaluation. Transparency fosters a relationship of trust and openness with learners. As we are all aware, it is very important that we include and address diversity and accurately represent the cultures of our communities. We as educators are strong advocates for the inclusion of diversity and priority communities, such as we have here in Hawaii, not only in healthcare curriculum, but in all learning environments. And as educators, we must continue to reduce the risk of harm to vulnerable and marginalized populations, increase quality of our teaching modalities, and achieve outcomes. In short, as sim educators, we need to get back to our roots of psychological safety to guide us. For example, when preparing students for simulation and formulating our pre-brief, it is important that we respect learners and value the learner's thought process. Again, as I stated earlier, this approach provides the educators with insight into the learner's knowledge gaps and helps guide feedback. As educators in simulation, we work towards excellence. Part of moving toward this excellence is remembering our roots and building on our foundations. We must continue to create environments where participants are well informed and feel safe enough to contribute to the accuracy and reality of the sim experience with true representation of our diverse cultures and communities. These are simple concepts, yet vital for the creation of excellence in our learning environments and moving simulation into the future. Mahalo for listening. Aloha.
Okay, everyone. Thank you again, all of you, for joining us for Healthcare Simulation Week 22, 2022. And again, we're aspiring towards sim excellence in a new era. Dr. Higgins and I will be joining you shortly in a live Q&A.